So let me just fill you guys in a little bit. Edward works for a company in Switzerland called Regen Labs, and they do a variety of things, including a new PRP system, platelet gel system. And we've switched over from Harvest, whom we've been using for quite some time, to Regen. Regen has also asked us to participate in a study with them, specifically looking at the effectiveness of platelet gel when used in conjunction with some skin resurfacing techniques. So the challenge really in any study, of course, is being able to quantify in a clear fashion the results of the resurfacing or resurfacing with or without platelet gel. So in any case, since Edward has traveled all this distance, I figured I'd ask him to give us a little introduction to platelet gel.
So what we're doing is PRP. Obviously, we mostly call it PRP. I think here you mostly refer to platelet gel. PRP in general is referred to as a high concentration of platelets within its own plasma, and we have different components in the PRP. We have the white blood cells, we have the red blood cells, we have the thrombocytes, we have plasma and fibrogen and some sugar in the components. And obviously every patient's PRP is different, so you get different platelet levels within, let's say, the pre-sample, obviously, and you also have different values of platelets within the time of each patient. So each patient is different, but also within the patient, the platelet levels vary from between the times of the day. So if you look at the literature, I mean, PRP has been used for a number of years. It was first used in lab and animal experiments, and then it was the dentists who took it first into clinical practice, and it's gone on to orthopedics, sports medicine, wound healing, and really the latest indication, and this is the indication where Regen Lab really is the strongest player, is aesthetic indication. So we were actually the first to investigate aesthetic indications, so basically injecting PRP into a healthy but aging skin, and saw benefits in there and developed clinical studies to improve that. So we work with these tubes. These tubes have a vacuum inside, and we have a protocol where you take 9 cc's of blood. The blood goes into these tubes. It's drawn in there by itself, but by the vacuum, and through centrifugation, what you have is that the gel that you have here inside the tube has exactly the consistency to divide the heavier red cells, which are packed underneath the gel, and the lighter platelets on top of it. So this is how we can effectively eliminate the red cells. And really, our system is the most efficient in let's say, saving all the platelets during the process. So we have about 5% of the platelets that we are losing through the process. And if you look at other competitor systems, you're looking at 30 to 40% that platelets that die during that process. So in aesthetics, what are we using the PRP for? It's for skin rejuvenation, so basically a simple injection of the PRP into healthy skin, called also mesotherapy. And in Europe, we also use it for volumetric augmentation. We use it topically after laser and after peeling procedures, as Dr. Clevens has also shown in his own clinical studies. We do wound healing, and we combine the PRP with autologous fat. What happens is that these platelets inhibit growth factors, inhibit like a whole different cocktail of growth factors, and each individual growth factor has a responsibility, and for aesthetic indications, we are primarily looking at the epidermal growth factors, which initiates the production of collagen 3 and 4, which is really a different collagen compared to any other collagen that you have, for example, with a laser procedure, which is collagen level 1 and 2, which is like a healing collagen. So this is like a very interesting concept also to combine laser and PRP, because you have like a very broad spectrum of collagen activation. You also have the transforming growth factors, which biostimulate the cell activity, and you have the vascular growth factors, which supports angiogenesis and sort of improves the supply of nutrients to the skin. So we are creating like a mesh in the PRP. You also have fibrogen, and by activating the fibrogen, these fibrogen strings all connect to each other, and this is why we have why we create from a liquid PRP a platelet gel or a fibrin matrix, as some others call it. So like a mesh. Exactly. The mechanisms of actions are that the platelets release the growth factors in their determinately defined ratios, and there's like a whole series of biochemical activities that happen afterwards. The stem cells are attracted to the site and now differentiated.